Hello, everyone. I'm so glad to be here on this International Day of Action for Women's Health. It's organized by the Bureau for Women Health. I think it's one of the very beautiful initiatives of saying I'm fine. It is basically to collect all the people, all the women in various scenarios wherein we meet each other, interact with each other, solve our problems, and come out strong. I'm here to help you, and I join you on this initiative of I'm Fine. Actually, in this particular session, we are trying to cover heavy menstrual bleeding. Now, there are a lot of there are a lot of questions on various platforms wherein they want to solve the problems where they're confused. So I'm here to help you out for that. So if you have any questions, you must put forward in the chat box so that I can help you answer them and at least help you out in such a way that especially in pandemic areas where you may be having questions and you may not able to visit the doctors. So, heavy menstrual bleeding. Now, that is something which really concerns a large population. Almost like five women coming to us in the OPD, at least one out of five would be having heavy menstrual bleeding problems. Now, these are the girls who are very affected. They are the ones who don't know what to do, especially in a few days in a month, and they are getting this, so the social life, the work life, the family life, everything gets affected. Now, which is it when we should be visiting the doctors? That's a question. Any person who's bleeding for more than a week, periods, those periods which were lasting, everybody comes out with a regular cycle. You may have a 4 day cycle or a 5 day cycle or a 3 day cycle. So there's a regular pattern. In case you bleed more, and in case the bleeding lasts for more than a week, in case there is a passage of clots, in case you are soaking the pads maybe more than one, in almost like a every hourly you need to change the pad, or maybe you're getting up at night so that you are just soaking yourself and you need to change because you want to protect yourself. So these are the ones. And of course, in case there is something like passage of clots which are not getting controlled, and here it is, you are depleting yourself, you're feeling tired, you're feeling mentally drained, you're not able, whether you're a schoolgirl or an office worker or a family or a housewife or whichever profession, but you are feeling tired, you're not able to perform your duties, maybe for 4 days, 5 days, 7 days, and whatever this loss of working days means, it's a lot. Because in case 1 week out of a month, if you're not well, if you're incapacitated, it's not fair on you, because that's a very important part of your life. So we must cover it. And also, one thing that I would like to highlight here is that, sometimes these problems are basically just reflecting a underlying pathology, which you may not even have realized that there could be something which is more to it. And when is it the right time that you should visit the doctor? So, to visit a doctor, it is very important you fix yourself a time with the doctor and visit. Now, what are the causes which are causing this? There could be simple thing like there could be an imbalance between estrogen and progesterone. Now, we all know there are two hormones in the body which come into play. The ovaries are the ones which secrete the hormones, and it's the play of the estrogen and the progesterone which is at a balance. In case it gets into a disbalance, you can have a bleeding which is much more than normal. Then there are other cases that you could be having. You may be having a thyroid problem. You may be just a simple polycystic ovary problem. There could be ovaries which are not, they are not going into a normal regular pattern of a menstrual flow. It could be a disbalance which could be there. So these are the problems. Then there could be something like there could be a fibroid sitting inside. There could be a small polyp sitting inside, or there could be something like a adenomyosis in which not only you bleed more, you also have a lot of pain. So these are the conditions, or there may be other conditions as well, wherein a visit to the doctor is a must. There are certain timings during the month or during your lifespan that could be a normal phenomena. For example, a young adolescent girl. Now, a young adolescent girl can have anovulatory cycles. By that I mean there is ovary which is acting, giving you hormones of estrogens and progesterones. But because now she just started her periods, she just turned, into she just started periods means you started your menarche and now you started. So the first 1 year or maybe 2 years, there is a balance which has to come on because the ovaries are acting under the effect of hormones which are getting secreted from your brain. So the brain hormone and the ovarian hormone get into a cycle wherein the egg gets released and your normal pattern carries on. In case there is a disbalance between there's no ovulation happening, then there could be a progesterone deficiency and a young girl can be bleeding much more. So all these things have to be kept in mind. And here is this girl who has turned menopausal, thereby meaning that she is now turned menopausal when the periods have to finish. If a girl has, after menopause, a spotting or a bleeding, it is definitely a cause of worry, and you must visit your doctor. So these are the situations which are there, and it's very important to pick out any underlying cause, or at least to know as to what is a normal, so that you know what is abnormal, and that's how you can pick it up. So it's very important to visit your doctor. And when you make a planned visit to the doctor is going to run through a lot of your history, your blood tests, your ultrasound, etc. So now I would just like to say one thing, that during COVID times, during this pandemic times, please try and locate a doctor, fix up an appointment, have all your blood reports in case you've already got some done and now you further want to get it done, checked out with another doctor. You must share the reports and you must have them all on your telephone so that you don't carry your bags and your papers with you. Everything you should be clear about as to what treatment you've taken. I always suggest to my patients that please take a picture on your phone of these treatment which you've already got and then move on and visit the doctor, plan a visit. Now, this is the time when you visit the doctor. She's going to work you up and you can have, on a simple ultrasound, things can be picked up. Now, that is the simplest, cheapest modality to be used to pick up any kind of a problem. And I'm going to tell you what are the problems that we are looking at. So the doctor's going to do he or she, I should say that. So the doctor, the gynecologist will ask you to have some ultrasounds and blood tests, etc. And eventually, whatever comes out will be your management. That means that will be your treatment. Now, that treatment will depend upon your age, about your obstetrical history, whether you're married, you have babies, what is it that you're looking at. That is what it will all be about. So in case all these reports were to just tell you, now here is this young girl who's reported to you with a polycystic ovaries, which has been picked up on an ultrasound. The doctor is going to give you treatment, simple pills, birth control pills, which depending on the various analysis, if there's presence of acne, there's presence of hair growth on your body, on your face, on your body, she's going to put you onto simple medication, which will be cyclical pills, which you can take for 3 to 6 months and be under follow-up. If you're obese, you'll be asked to reduce your weight. These are very important things. If there's a thyroid problem, you'll be given treatment for that. One important thing in a young girl, now I've moved on to a young girl who is say 30, 40. Remember one thing, there is one uterus, two ovaries. Ovaries are the ones which will produce, the egg, once from the right side, once from the left side. And it's the ovarian cycle which goes on to give you a normal, regular period. Now, this uterus, once the ultrasound is done and you're having a bleeding, which is much more, the first and foremost is to see ovaries are okay, the uterus, tube and ovary are in the correct axis. Then the lining of the inside of the uterus, which bleeds every month. It's the inside of the uterus which bleeds every month. So that lining in a young lady is about 8 millimeters. So that 8 millimeters has to be, if it is 8 millimeters, we are happy. If the girl is below 50, below menopause, it's a 8 millimeters. Okay, you are told this is what your endometrial lining is, and that is the way it is normal. So in case it is about 10 to 12, that means estrogens are acting a little more, progesterones a little more less, then you'll be accordingly given treatment. and you will be told, we normally always tell the patient, okay, you take this treatment for 3 months, and after 3 months, please try and report to your doctor, because you know the inner lining was more than 10 or 12, and you give the hormones, and then you call them on day 2 or day 3 of periods. Why? Because on your first visit, your ultrasound has already checked your uterus and ovaries, your pap smear has already been done, and now all we are worried about is to see the inside of the uterus. So we are actually going to see the lining and then report after 3 months, because we want to know that on the day 2 or day 3 of your periods, the lining should just be about 2 to 3 millimeters and not more than that. In case it is more, then I'm going to decide, the doctor is going to decide, okay, I'm going to give you some more hormones. That means I'm going to step up the dose. I may have given you less hormones, and now I'm going to step up the dose by giving you some, a little bit of more increment. So that is what it's all about. That is number one. Now, in a lady who's more than 50 years, her age is more, 50 साल से आप ऊपर हैं, और अगर आपकी लाइनिंग अब अंदर आपकी 8 मिलीमीटर मिलती है, 10 मिलीमीटर मिलती है, then I'm not going to wait. Then I'm going to surely take a good pap smear or a liquid based cytology, check you up for any ruling out of cancer. Because remember, it's only at 50 years that you can get cancers of the body of the uterus. And that is the time that you're going to be looking at the lining. And in case agar wo zyada hai, then you should take biopsies. So you have to rule out any cancer in the young lady or maybe 50 plus. I call it young because I'm older. So that is the a very important point. Another thing is that in case you've just gone with a bleeding which is more heavy, and when ultrasound just picks up a fibroid. Now fibroid has been picked up. Now this fibroid in a young girl. Now if she's young, she has to definitely, the fibroids are tumors of the uterus. They are called myomas, and they're basically the tumors of the body of the uterus. So this fibroid, because of the presence, it has effect on the inside lining of the uterus, and it causes heavy bleeding. Now, in case the fibroid, depending on the type of fibroids, you will ask the patient. Of course, the age is age is an issue that has to be considered, and also the obstetrical history, how many children she has, whether she wants to save her uterus, then her age. If she's a young girl, say about 30 years, she's completed her 2 babies and she doesn't want more. In fact, she would much rather have a tubectomy, means ligation. She doesn't want more children. She says, "Hamare ko band karana hai." So in that case, you will not definitely tell her कि तुम अपना 30 years में uterus निकाल लो. But at the same time, you can definitely give her a option of fibroid removal. Now, fibroid removal can be done with the open technique wherein the abdomen is cut. But we have been doing laparoscopic fibroid removal for years. It was the year 2000, we got recognition, and we've been doing fibroid removal only with the laparoscope, so that, very small holes are made on the body, and you take it out laparoscopically. Patient can go home in 1 or 2 days, and there are no do's and don'ts. She goes back home, she can go up the stairs, down the stairs, she can go around her activities in 4 to 5 days' time. Back to normal official work, doctors go back to work, carry on with their normal activities. So they know nothing, you're not staying back. So fibroids need to be removed in case the patient wants to conserve the uterus. In case the patient does want to conserve the uterus, she says, okay, I'm already 48, I want my uterus out. In that case, we would like that we should do a total removal of the uterus. And we always make a very, very clear, we have an interactive session. We tell them, okay, your ovaries are like this, you're 48 years. And if you're 52, then it is like this, because very soon they should realize they will have menopause, and they should make a conscious decision whether they want to save the ovaries or remove the ovaries. That is the patient's prerogative to understand and to do. So this is something about fibroid. Coming to polyps, in case ultrasound has picked up polyps. Now, what are polyps? They're basically the same uterus, the inside of the uterus, the lining which has become thick has got some polypus. It's just growth inside. So there is no way that you can do a plain DNC. एक जमाना था आप DNC करके उसको निकालते थे, but you were always failing in that because you could never reach it. You cannot pick it up. So what you do is you go inside with a telescope. Now this telescope is a beautiful thing. You go inside with a telescope, you visualize the inside of the uterus, and you just pick up the polyp and get it out, and you test it in case she's not, it's not malignant, there's no cancer, we are very happy. Now just imagine there's a lady who's already 60 years old and she's got some bleeding, and the ultrasound picks up a little thickened, maybe query polyp. You remove the polyp, you know you've taken out the base, and you know that there is going to be no bleeding, there's no cancer, then the patient is, her job is done, she doesn't even have to go undergo any hysterectomy. I hope I'm clear. Any questions, please do ask, because you have to ask questions for me to be able to answer you. So, the important thing is that you have taken out the polyp, and your job for a post, 60 years, 70 years, 80 years lady, it's already done. Because you're always worried, okay, here's this old lady, and this is the age when cancers do happen. So if you were to remove the polyp, and now you were to, remove the polyp and get it tested, and you're sure there is no cancer, you're fine. The family is fine, you're fine, and you can happily say, okay, that's good. So that is the way it is. Now, here is another case of adenomyosis. Now, adenomyosis is when the inside of the endometrium, that is the inside of the uterus, is getting inside, getting inside the wall of the uterus, getting it insinuates inside, and then there's tremendous amount of pain, and this pain also gives a lot of, there's pain and bleeding. Now, this girl she has so much of excruciating pain that she'll be running from pillar to post trying to find out somebody to do her surgery. Well, anyways, she has to reach the doctor. And again, the whole thing falls back on her obstetrical history, her age, and what is it that you can offer. Now, if there is something, we've finished with polyps and fibroids and these, there might be just some cysts. Now, these ovarian cysts can be there which are causing some kind of issue, hormonal up and down, causing bleeding. So these are very simply to be dealt with by simple tablets of hormones which can balance it out, and actually even by 3 months you could just be normal. But one thing very important is that a simple, at least once in a year checkup with the doctor, having an ultrasound done, which is the most cost effective modality, will tell you as to where your health is. And also a pap smear done by the doctor is extremely important. That also is so cheap. So if you have done that much, it tells a gynae health is totally covered. So these are the things which have to be kept in mind. In case you have an issue, please visit your doctor, and remember that be safe. So when you come out of the bubble of your home, make sure that you're visiting the doctor in a way that you have a prior appointment and all that I've already mentioned earlier. So if there are any questions, do ask me. And in case I'm trying to read actually, in case okay, there is, okay, is there any question that you would like to ask for? Okay, I'm just trying to read the question. Irregular periods that don't properly bleed. Okay, there's no proper bleeding. There is something wherein you are having irregular bleeding. Okay, I have my young. So I have my daughter-in-law, Dr. Shivani Sabharwal, who forms a beautiful team with me. I get a lot of help. Come here. Shivani. So. Yeah, so I was asking.
Hello, everyone.
So, there were questions which I was looking for, and she has nicely helped me out. So, what are the
So
questions?
we have a question from Nazia.
Okay, now just listen to a question. Shivani is going to read out the question.
So I am Nazia. I'm 32.
Okay, now just listen to a question. Shivani is going to read out the question.
2 years I underwent laparoscopic cystectomy, but still I have heavy bleeding every month. And now in my pelvic scan, it's showing bulky uterus. Rather than that, all reports are normal. I have 2 children and tubectomy is being done. How to proceed?
इधर ही बोल दे. हम अपना वॉल्यूम कम वॉल्यूम ओके आप इधर ही वॉल्यूम स्पीकर पे करना ओके सो व्हाट इज द क्वेश्चन
So
नाउ
she has undergone a cystectomy 2 years back and she still has heavy bleeding. She has two children and she's been sterilized, as in tubectomy is being tubes are being clipped.
Okay, so now this lady is already got two children. She's young, right?
Yes, she's 32.
So she wants to save her uterus and ovaries, and she wants some conservative management for this kind of a bleeding which is affecting her. And definitely, there are three things that we are going to be doing. Now, one is that we'll give her hormones which are going to balance out her. There might be just a estrogen progesterone imbalance, which we want, which mostly they result in ovarian cysts. And these ovarian cysts mostly either you can either the doctor can just be patient, can just wait and watch it, or she can give hormones to balance out the estrogen effect, and then you watch it at the same time when you're giving this, and you may land up giving her just simple birth control pills if she can have, but she's already sterilized. But even otherwise, birth control pills are very physiological to your body, so they also have a very good positive effect on keeping a balanced thing, and the hormones, the period can become normalized after taking 3 months of simple birth control pills. Then the other thing is that in case now when you are following her up with the birth control pills, and or you've even given her progesterones, whichsoever progesterones, but you call her for ultrasound maybe after 6 months, 3 months of giving the pills and 6 months of doing an ultrasound and revisiting the doctor. That is going to help you. So one important thing is that her uterus is bulky. Now, if it is bulky, then I would suggest that we should even look at other things which are there in the market, because there are new chips in the block, like from the progesterone. There are other, refined progesterone, the next generation of progesterone which are in the market, which are going to not only prevent the bleeding, they are going to also prevent the further worsening of a situation of a bulky uterus. So they should be openly discussing with their doctor once they visit that what is it that besides progesterone we can take.
Excellent. Another question is from Miss Neelam. She is saying my endometrial lining is 20 mm. She has not mentioned the day, but she has written my endometrium lining is 20 mm.
Okay, so now this young girl, or see 20 mm lining. That means the uterus. We have already know that the inner lining should not be beyond 8 millimeters. It is 20 millimeters. A good ultrasonologist will always tell you that there could be a polyp inside, like we were discussing earlier, the polyp, and it may not be there. So when you go inside with the best thing would be to go inside the uterus with a hysteroscope. Now, hysteroscope is the same what we discussed, a telescope which is put inside the uterus and you visualize the inside, because there could be some growth inside, there could be a polyp inside, or there could be a generalized thickness. You also visualize that there are some blood vessels which are there. There could be certain things, certain areas wherein you feel this could be the defective area, and targeted biopsies. When we say targeted biopsies, means that you are taking the biopsies from the area which you are suspecting. So that is something very, very important. And after taking the targeted biopsies, then you can even do a complete, the curettage, or you have just come out and the biopsy report comes. And once the biopsy report comes, depending upon what the report is, you can proceed, depending also on the age of the patient and the obstetrical history and what is the kind of situation, whether she wants further babies or not.
Excellent. The same patient has said, I have got my IRCT removed. Can you please elaborate what is IRCT, Ms. Neelam?
Now, what is IRCT? I'm not sure. Is it an intrauterine device that you're talking, or is it something like a Mirena, which is a something like a progesterone loaded intrauterine device? So if she's had that removed, maybe it is an intrauterine device which was loaded with progesterone, has been removed, and now the lining is thick. Then of course She definitely requires a hysteroscopy and targeted biopsies, because despite the thing that she was using, the lining is still thick. So we cannot let her go like that. So your biopsies are a must.
Excellent. Another question is, good afternoon, ma'am. I'm a 20-year-old girl and I have fibroadenoma in my both breast. Usually, I get irregular period. Is there any connection between the two phenomena?
So, you see, if you have, remember one thing, fibroadenoma, she's a young girl. She has a fibroadenoma breast. Now, these are small tumors. We also call them the, mouse in the breast. So these are small tumors which are basically they're mobile lumps in the breast. One must learn how to examine a breast. What are the, how do you look after this? So once a girl visits the doctor, it's our duty to tell her how to, how to feel the breast and see the mobility of the tumor in the breast. So that is something which you should do. Number one. Number two, now this fibroadenoma may not be related to the uterus, because it's a fact that for every post-menopausal women, I personally don't want to give them any HRT, etc. In the, unless I'm totally sure there's nothing. So any history of family history of breast cancer, etc., is a mandate before we give any hormones after after the patient maybe 45 and above, or maybe menopause and above. This is something that we have to keep in mind, because we know that these hormones can be causing breast cancers also. So, therefore, one has to be very vigilant. One has to be very thoughtful about taking any hormones after your menopause. So, having said that, do not worry, this young lady. If you have a fibroadenoma, if there is a need for any hormones for a uterine problem, you can go ahead and do it. But at the same time, I would like to add one more thing, that today, small lumps which a girl feels, just because I've told you you've examined the breast like that, and you see, and if it's a mobile, it's okay. But an ultrasound is very, very important of the breast, because in a young girl the breasts are dense, and there's nothing like a mammogram which is going to pick up. It's only ultrasound, because these dense breasts, the yield means, if you cannot pick up on a mammogram, but definitely on an ultrasound you can pick up a small lump. And in case the ultrasonologist doctor tells you to have a true cut biopsy, means आजकल FNAC कोई नहीं करता ज़्यादा. FNAC means fine needle aspiration. They always advise you a true cut biopsy, wherein you take biopsies and then proceed. Do not let it be and take the biopsies. Okay?
Excellent. After taking contraceptive, I had delayed periods for 2 months. Can contraceptive creates any problem because I am feeding my 2.5-year girl child? Please advise.
So, in a young girl who's taking contraceptives, and she's got a newborn, young child. How old is the child?
2.5 years.
2.5 years. Okay, then it's high time that you stop feeding the child now. That is very important. Please wean off the child, because these children just are used to getting that kind of a placebo effect, and that works more like a pacifier to a young child. So please stop doing that and let the baby grow up. Now he's a 2.5 year child. So let the baby grow up, eat his proper meals, wean them off, and let it continue. So this is something extremely important, and you please have your contraception by using whatever pills you have, or the doctor can suggest you with good pills. And make sure that you don't have heavy breasts, and your breasts dry up in a natural way, or by taking help you can take some kind of tablets.
Uh, Jasleen has asked, it's been over an year. My cycles have changed from regular 28 days to 21 to 23 days. Is it normal?
Well, what is the age for Jasleen? Can I know? I'm sorry, I think I would like to include Shivani in my picture. She's not coming because, she, no worries. Come. She's a very pretty girl. You can anyway see her.
I'm not ready for it.
Acha, aaja
That was
jaldi.
just
Okay, here. Come.
So, Jasleen, we would like to know what's your age to give you a better answer for this question. If you can type it in your next Okay, you're 40-year-old girl and your periods are, is it regularly regular, or it's as it is always 21, 23 days, or it is irregular now?
No, she says now it's become a shorter
Short
cycle.
cycle.
So I think, Jasleen, you're 40 years old with a shorter cycle now. So definitely you should visit the doctor and let them just do a simple ultrasound and a test for you. So when you go to the doctor, make sure that you're not bleeding, because you can have, this is the pandemic time, and you can make sure that your both, your pap smear and your ultrasound will be done in the same sitting. So please make sure that you're not bleeding. Time your visit, tell the doctor, no wasting time, and you want everything done, sorted at the same time. It could be a simple ovarian cyst, and we could just tackle it like that.
Alicia has a question. My periods cycle is regular, 28, 29 days, but I do not get proper bleeding, which I used to get earlier. Is it normal?
Okay, so this young lady, for such a kind of a changed pattern of her period, which is now she thinks it's scanty. Number one, we would like a simple ultrasound. We would like a thyroid and a prolactin level. Now, thyroid is something which is so rampant. Every health checkup, we are doing a thyroid check, because today is a time when there's so much pollution. I mean, talk about pollution, my God, things are really going bad. So, it's very important that we do that ultrasound, we do the thyroid checkup, we do a prolactin level, which is just like I was talking about estrogen and progesterone. Prolactin is another hormone. Now, a girl who delivers, I'm just talking randomly of a young lady who's delivered. Now, this lady in the at home will be told by the mother-in-law, the dadi, the nani, that okay, now you will not have, once you're feeding, आपको period भी नहीं आएगा और बच्चा भी नहीं रुकेगा. It's a very common thing. So there is a what happens during that time when she's feeding the child, the prolactin level goes up. When the prolactin level goes up, then that is the time that her periods may not happen. May become less. Then she may go into periods of amenorrhea, means no periods at all. So these are things which are seen in such cases. So we just have to have simple investigation and we are sorted. So in case need be, then biopsies have to be kept in mind.
Next question is, good evening, ma'am. I have menstrual period occurring twice or thrice in a month, and it continues for 2 to 3 days and heavy bleeding. Is there any hormonal disorder or any other reason?
Most likely there would be a hormonal disorder, because if it is happening more frequently, number one, we have to look out. There is no, the things what I mentioned earlier. We always see any infections can also lead to this kind of a problem. Thyroid prolactin levels have to be checked, and an ultrasound will pick up any other simple cysts, etc. So that, having said that, because she's young and you're lining, everything will be picked up in a similar way, and it should be sorted, because either you'll be, in that case, you'll be needing, if everything is ruled out, then you'll just have to go onto a pill for say about 3 months.
The next question is, I think this Mrs. Neelam has answered her question, that the patient who asked about who's having a endometrial lining of 20 mm, she said she had undergone a biopsy and it showed a polyp. Now she's a 51-year-old girl and she's taking Cistron NCR, but when she stops the medicine, she bleeds again. What is the treatment option for her?
In such cases, there's always something like a recurrence of a polyp. So whenever we remove a polyp, keep it in mind that it's not absolute. So आपने बेशक root से निकाला है उसको, you got a test also, it's all clear. But it's a tendency of the uterus to form polyps. So in case you are forming recurrent polyps and you're already 51 years old, I think, आप कितनी बार ultrasound कराने जाओगे, कितनी बार biopsy कराओगे. So I would say that in case you want yourself sorted, might as well remove the uterus. And removing of uterus is done in two ways. One is by an open conventional surgery, wherein you're getting about 6 to 8 inches of a scar, and vis-a-vis a laparoscopic approach. Now, laparoscopic approach is where you're just going in with something like just like a pen. You're just going inside like that, and there's there's a camera attached over here. The camera is the one which gets attached to a monitor. You look at the monitor, and the doctor will do a laparoscopic approach. Means you are doing the whole surgery with something like you look into the monitor, just like you play a game of, Nintendo and all that, those games which you play. which you're driving this car going like this, like that, and you're basically looking at a screen and you feel that you're going in a racing car. It's something like that. So you're looking at the screen, you do the whole surgery, and here the patient the next day, even if you had a long surgery, the next day you're up and about, you're walking around. There's nothing to hold you back. It's not that you're going to be, you are there are no do's and don'ts. You can climb up the stairs, you can move around, you can bend down. There are very, very simple way of going back. So I would much rather suggest that you should go in for a hysterectomy and make sure that you know that laparoscopic approach is here. We started in our hospital as early as 92 and 2000. We have really, so we have been doing laparoscopic approach for a long, long time. And this is approach which is very simply available to you. We have taught people, we've been teaching doctors in the laparoscopic approach. The patients, a big uterus or a small uterus, everything comes out and you're back home with the same little cuts, whether you're mota or you're patla. The same telescope, the same thing, telescope will go like this. If you're thin, it's only the thinness of the abdominal wall. So that doesn't make a difference. So if you're fat also or something, it's only this which goes inside. If you're an obese one, and if you're a fat patient and you need a conventional surgery, means itna mota to aapka fat hi hoga skin ke upar. So that healing becomes a big issue. So remember one thing, that hysterectomy is the choice in case there is recurrence of polyps and you already crossed the age of 50 years.
Excellent. I think continuing with the same question, another patient asked that she had a DNC hysteroscopy. How many days of precautions are required and what all precautions?
You see, in a hysteroscopic polypectomy, it's like a daycare. You do it, she goes home. Thereafter, you just tell them, okay, you might have a little spotting. That's about it. Simple oral antibiotics. You carry on with your work, whether if you're working with a working lady or a household lady, whatever you were doing, you can just continue with that. You take 5 days of antibiotic, 2 weeks of no intercourse, and after that you're free.
Ma'am, I'm a younger girl. I have irregular periods and half month and not proper bleeding. So basically, she's saying I have irregular periods and half month and not proper spot. That means she bleeds less, and I think she bleeds for long. That's what she means. I think.
Okay, so I will touch upon this. This is something very, very important. You see, we all must know that a girl may have a bleeding for 2 hours to 1 to 2 days to a week. But if it is a regular pattern, if it is following a regular pattern, barring the time when she started her periods, that was the menarche time, she had a little bit of irregularity and thereby it settled. And over the years, there's a pattern that she's following. So once this pattern is being followed, we should say that that is your normal pattern. Any change, like this young lady is saying, that in case the bleeding is happening in between, we call it the intermenstrual bleeding. Whether she means intermenstrual bleeding, she must make a menstrual calendar wherein she will understand it could be a pictorial calendar. By that I mean, say today is the 28th of May 21. She'll make a little, a chart like a leaf. Okay, I use 5 pads, means she'll put, there's something like a pictorial calendar she can make, and she can just keep a diary and she can report back to the doctor with that diary. Then she undergoes all those investigations which we have been talking about all along our talk, and be ready to have hysteroscopy for sure, and biopsies, and the histopathology report is extremely important. Don't forget, hysteroscopy ho gaya, chalo, you're sitting at home, not picking up the report. It's your duty to pick up your report and to show it to the doctor and get a feedback from the doctor. Very important.
Okay, excellent. I have PCOD and periods come 38 to 40 days. I have to take stimulate. I think she is being stimulated. I think stimulated with 5 milligram for conceiving 3 months. But I have not conceived, and I am 31 years old.
Okay, then, in that case, your period is your problem is basically you are looking at a pregnancy, and you're a case of polycystic ovaries, and you're looking at a pregnancy. So you should visit the doctor, and the doctor is going to give you good advice and follow you up on your various levels. and your ultrasound, with your ovulation scan, with your husband getting investigated, you getting further tested so that we can expedite and you get pregnant. And mind you, over here, I would like to tell you one thing. How old are you? What is the age?
31.
You
31.
are already 31. So do not waste time. And also, there's a way where we assess, though it is, the ovaries are assessed by doing an AMH, wherein we know that what kind of a reserve is there in the ovary. Because we all must know that after the age of 30 years, the ovarian function tends to go down. So do not waste time. And also, now that the vaccination is open, remember to take care of yourself by taking your vaccination right away. Make sure that you take your vaccination and you are ready to get pregnant without wasting time, and visit the doctor for sure.
Very nicely explained. Next question is, ma'am, I have regular periods, but for 2 to 3 days it's very heavy. Is it okay?
No, it's okay. In case it's been happening like that for so many years, you can just go for your health checkup. I mean, that's being intelligent, because everybody should take a health checkup. Let me tell you, it's very important. That's the first thing that you should do to yourself is, okay, it's my birthday. You can choose a date, your birthday, 15 August, 26 January, Diwali. You can fix up a time that every year you must have your own checkups done, your own self. But every woman has to make sure that you're fine so that you look after your husband, your children, your family, everything. So please make sure that you visit the doctor and get all your checks done. And that's about it. If all is okay, just take simple tranexamic acid. These are things which can just they give you strength to the blood vessels to make sure that you do not bleed that much. Number one. Number two, remember to take your supplements, your iron and your calcium, because having said that, I must share with you that when you're working in England and America and all, they don't give so much of iron and calcium because most of the meals are all fortified. They are already they have got all these nutrients which are added up to these preserved foods, etc. But I feel that our Indian way of our eating ghee, tori, sabzi, dal, all that is so beautiful that we are naturally more strong. We have less menopausal problems. We are more, we adapt to menopause beautifully. And because we have our own spiritual way also, and being secular, you have all kinds of ways of doing puja, whether it's you're following Islam dharma, you're doing 5 times namaz, or you're doing two, your sandhya, your morning prayers. All those things help you. I feel that everything helps you and you have a very healthy style. And I think on that note, let me just check out the time. Have we overshot, or we can still carry
We
on?
can just take few more questions.
Okay.
One of the patients, I mean, lady has asked, what's the best treatment for adenomyosis?
Well, for adenomyosis, now this is a very tricky thing. It causes a lot of problems. It could be pain, it could be bleeding, it could be infertility. So depending upon your age and your need, it can be it has to be organized and worked out, because your need is that person's need. And in case your family is complete, everything, and she's really run down with problems, then the ultimate answer would be to remove the uterus and both the ovaries. But before that, for a younger lady, there are a lot of other things which have come into the market. Progesterones are there. There are newer progesterones, which are the latest ones which are available, which can be used for such patients to give you relief of the symptoms. And you can carry on holding on to the uterus and the ovaries.
Continuing to question same, it's related. I am 30-year-old and I have adenomyosis and bowel endometriosis as well. I have already undergone a surgery for endometriosis. How to proceed?
Oh, then please be on conservative management for some time. I'm sorry, I did not catch your age. What is your
30
age?
years.
Oh, you're very young. So I think for you, the best thing would be for you to carry on with your, with your, the, like I was telling you, the latest progesterones which are available, or there are something to relieve your symptoms, and you should just be conservative for your treatment, because ultimately, for adenomyomectomy, I mean, for adenomyomas, you have to remove ovaries also to relieve you of the symptoms. So in such cases, it is important that we wait for some time and we wait for some time and then organize. If you can get relief of your symptoms by taking these pills, it's good. In case you're looking at pregnancy, that in case you want pregnancy, then we can think of working out an MRI to do where is the adenomyoma, whether there are, then we plan to do a laparoscopic adenomyomectomy, which will reduce the bulk of the problem that you're having in the uterus, and we'll ask you to the earliest possible go into a pregnancy, whether in a natural way or by an IVF or a ART. That means artificial assisted reproductive techniques.
Excellent. One lady has asked postmenopausal bleeding, what is the management?
Postmenopausal bleeding has absolutely, it is that first thing is get your hysteroscopy done. The hysteroscopic evaluation is the must. Targeted biopsies are what you're looking at. And once the report comes, then you can think of doing a hysterectomy, that means removal of the uterus. And remember, whenever we do any procedure, any gynae procedure, like a hysteroscopy or a laparoscopy or a ligation, a simple young girl with no problem, just a ligation, something very important is to do a regular pap smear. Pap smear is a simple cytology test wherein the little mucus from the mouth of the uterus is picked up and assessed. The report, it's very cheap, doesn't cost much. The report comes in 5 to 7 days and you're mentally sorted. Any procedures, gynae procedures, normally we are doing only after your periods. So remember these couple of good points that we have to keep it in mind.
Ma'am, my wife is Poonam and she's 30-year-old and she had two children from Jeevan Hospital.
Wow.
First time she faced continuous period for almost 15 days. Is it normal?
You mean to say after the childbirth she had bleeding? Of course it is normal, because after the childbirth you are going to have a period which lasts you for like 40 days. ये तो सदियों पुरानी बात है जो हमेशा से आती है. The only thing is you have to keep in mind the bleeding pattern is that you will bleed initially the first few days heavy, then it will keep coming down, then it will become pink, and then it becomes colorless. And all along, if the good hygiene is maintained, you're encouraged to have a bath every day, wash yourself with soap and water, make sure that the sanitary the pads are changed frequently. Then after that, you have to be, there's no smell, there's no foul smell. In case there is a smell, means there could be infection. And in case there is infection, then you need to visit the doctor for sure. So 15 days is not to worry, as long as after that it's going down.
I think we have time to take one or two questions only. Ma'am, I have PCOD and suffered a lot from childhood. I'm 21-year-old now. I visited doctors and consumed many pills for almost. Ma'am, is it bad if I continue taking pills for a long time?
I would like to know as to what is your weight and what's your height. Because the most important thing is that sometimes the PCODs, but the majority of the time, the PCOD are related to, a heavyweight, obese patient. That means the weight is more. So the first treatment for a PCOD is to have a lifestyle management. Thereby, I mean that you should work out. Try and do all the household chores. I mean, this is the best time. You can do all the dusting, the sweeping, the mopping, everything. You can do your cooking. You can have some good hobby. You can do exercises. You can follow the various exercises available on various sites on YouTube, etc. Make sure that your weight should be the right weight for your height. So, having said that, one very important thing is that you should eat healthy. Do not have these eating from outside habits. Simple food, you can pamper yourself by cooking whatever you want to, but pamper yourself in the correct home done fresh food, which is very, very important. So if you're doing that, it's going to help you to go a long way, and any hormones imbalance, etc., will get settled. Take lots of water through the day. So these are things which kind of clears your system, and eating right, eating on time, the healthy habits are what you have to do. You can, of course, take hormones which are available. There's nothing against that. But having said that, जितना भी कम आप अपने आप को ड्रग करो उतना अच्छा भी रहता है ना. So you can take for 6 months, give a gap for a couple of months, reassess you, and once you've got yourself sorted, then why should you take for a longer period? Nothing wrong in that, but you could just keep it in mind.
A patient has asked, how do I know if I have heavy periods?
Oh, that's a good question. There's nothing like, So let's recapitulate what I told you. A girl who was having periods only for 2 days and has now, over the time when she's become 40, suddenly had periods for 5 days, 6 days, there's a change of pattern. So that becomes heavy. A person, like any change of pattern which is showing excessive bleeding, wherein you're changing your pad more frequently, like I mentioned in the beginning, you're getting up in the night to change your pad, you're not comfortable, you're feeling the thing that you're getting, you don't feel up to, your energy levels are going down. So that means all these things are just pointers towards that maybe you need to take, spike up your nutrition, your supplements of iron, calcium, etc., and your checkups to the doctors to make sure that there's nothing else which is going just reflecting in a period which has changed in pattern. There should not be, a fibroid which is growing inside silently. So just a simple checkup and just these things what I told you is enough.
The same, I think we have to go back to a few questions because they have answered. The patient who was talking about bowel endometriosis, she said she's unmarried and is on Dynogest tablets since 1 year. And as per her MRI, she has got diffuse adenomyosis and stage 4 endometriosis. Her question is how to proceed.
Oh, now that's well, she can, if she's taking Dynogest, she should visit the doctor, and she should get her markers done. Now these are simple markers. If you were to actually Google and say that they don't lay much importance to these tumor markers, but personally, we feel that tumor markers are also something where we can fall back on, like you do a CA-125, etc., etc. Make sure that you see, one thing is good that you've already been operated and you have your biopsies, that there were no changes, but a close follow up is a must, because your ultrasound assessment, because there could be the time when you were assessed in the beginning, when you had the biopsies done, there was no cancer, nothing. So any ovarian cyst, any endometriomas, any thickened endometrium, or the uterus, which is giving a typical picture of adenomyosis, has to be under vigilance, wherein you are making sure that any pointers towards something which is, or some pointers have to be checked out on. So this is something wherein if there's no relief and you are very young, there's the last option is to do a complete resection, because वही बात है, जान है तो जहान है. So then you are looking at a complete resection wherein the uterus and the ovaries may be involved, and follow up is done subsequently. So that thing has to be kept in mind. But as much as possible, Dynogest, if you've taken for a year, let me tell you, I've had patients who are taking Dynogest for 5 years, and they've gone here and there and everywhere, and then they come back to. But very important is that you should have one good ultrasonologist to check you up, and your blood test to be done, assessed, and whenever there is an indicator, you should be, don't refrain कि मुझे दोबारा नहीं कराना है. You should get evaluation and further checkups done, because you know that these are the conditions, these are the patients who can, the incidence of cancer in the ovary, etc., is also more. And these things have to be kept in mind. So do visit the doctor, and they will be guiding you that you should further move on with biopsies or complete surgeries as the stage is.
Okay, I think we can just take last two questions. We'll again go back to
Dr. Shivani Sabharwal is going on saying last two questions, and she's
but
going on asking
people
questions.
people have so many doubts, and that's very good. It's a good platform for them to make things easy during this time. So this lady who said she delivered in our hospital, she delivered 8 months back, and now she has bleeding for 15 days. Is it normal?
Oh, you mean to say on a regular basis she's bleeding after 6 months of a delivery? She's bleeding for 15 days regularly
Yes,
every
yes,
month.
yes.
No, it is not normal, and she should definitely take help. And she should Please come and visit us back. हमारा नाक नहीं कटाने का बिल्कुल. Please come back to us. We'll solve your problem. Do visit us, and we will have to make sure that you're given treatment so that you're sorted. And take your iron and calcium supplements.
I think this would be the last question. Ma'am, in this month, I have had my periods after 55 days. In this month, she had periods after 55 days, and my fibroadenomas enlarged. But after having periods, they had shrunk. Is it related?
No, no. You are saying that your
Periods came after 55 days,
okay.
and initially the fibroadenoma enlarged, but once she got her periods, that's the same fibroadenoma shrunk.
Okay, now that is a strange thing. So it could be hormone related, but I hope we all know that many of us would realize that prior to periods, the breasts are very sensitive and they become a little lumpy also sometimes. So please have yourself assessed properly. And it's a fact to know that the sensitive breast, any changes in breast, maybe your own perception also. So in case you can have it assessed in a proper way, wherein the thing is actually कि इतना centimeter का fibroadenoma है और तब क्या हुआ. So this thing is something very important. Don't take it lightly. Visit the doctor. Have an ultrasound done for your breast as well as for the pelvic ultrasound for the uterus and ovaries. Don't leave it at that. So I would say that it's been an excellent platform and we have answered so many questions. And I'm so happy it was an interactive program. And I hope it has benefited you because I've enjoyed talking to all of you so much. And I hope this kind of an initiative carries on. And we all get together and definitely make sure that all of us are saying, I am fine. And I'm going to catch hold of this girl also. Come here, come here, come here, come here. She's not coming. So we all say, I am fine. So we all say, I'm fine.
We'll
right?
all fight COVID together.
Yes, yes. So we all have to say, I'm fine and be together. And we have to say a big thank you to the organizers for giving us this platform in which I will say, I have to say Silas's and Hatim's because he was the person who was the technical advisor to put us onto the Facebook Live together. And thank you so very much, all of you.